Today I am going to show you one more interesting topic, the arthroscopic repair of subscapularis tear. In today patient is 52-year-old gentleman, is having positive belly press test and having difficulty in doing the activity since long time, and we tried conservative management and intra-articular injections, but nothing works. And today we have decided to go for repair this tear arthroscopically. In the subscapularis tear, most important thing is how to detect the finding on the MRI. So only two things you have to remember, that you have to see the axial and sagittal image of the MRI. On the axial image, you can see the retraction of the fiber of the subscapularis along with the empty at the lesser trochanter. Along with, you can see some fluid signal in the subscapularis tendon. Second thing, on the sagittal image, you can see also the retraction of the fiber. Also, along with this, you can also check the location of biceps in the bicipital groove, which should be in the center. If there will be any displacement of the biceps tendon, then you can suspect of subscapularis tear. Now I am going to show you some images of axial and sagittal plane of MRI for this patient, and later I will take you to the OT to see how we are going to do the repair of this subscapularis tendon. So this is the axial and sagittal image of the MRI of this patient, and this patient I have already seen before this MRI, so I will explain in the details. So in the sagittal view, you can see this is the lesser tuberosity, and you can see this, there is some fluid signal along with the elevated fiber, and which this is the subscapularis fiber. If we are going to check on the sagittal image at the same level, you can see this, the changes, and so you can see the lower fiber. As you can see here, lower fiber is in the continuity, but mostly the upper fiber, when we are going to check this, you can see this fiber here, and the same fiber, you can see this is the retraction fiber, and there is along with the some changes, and here you can go, if you are going inferior, this fiber is continuous. So mostly this will be the tear of the upper fiber, like you can say like more than 2/3 of the fiber of the subscapularis has gone. And while doing the arthroscopy, we have to always check for the coma sign, which is very important for the subscapularis tear, and it's happened because of the retraction of the subscapularis tendon, and also from upside down the retraction of coracohumeral ligament along with the superior glenohumeral ligament, which now I'm going to show you on the arthroscopy. So this is the arthroscopic image of complete subscapularis tendon after release from the surrounding structure. So this is the normal arthroscopic image of the subscapularis tendon, and in this case you can see this is the complete separation of the tendon from the footprint of the lesser tuberosity, and in this I already passed the suture thread, and I have placed 2.7 mm 2 suture anchor containing 8 threads at the lesser tuberosity after preparing the bed with the saver and bow, and then you can secure the suture with passing through the subscapularis tendon, and after that you can go for the sliding knot to secure the subscapularis. And this is the final picture after the repair of subscapularis. You can check through the internal and external rotation, and now you can compare also with the normal arthroscopic and the repaired one subscapularis tendon. So this is the final picture after repair, and you can see this, the tone of the muscle is intact. Thank you for watching.